I was in college and was a college baseball player, and the number one thing that I wanted to do was really make it as a baseball player. So I was that guy who, when I opened up my locker, all these gadgets would fall to the floor. My teammates would all make fun of me because I had the strength shoes that were supposed to make you faster. I had a helmet that was painted a special opaque white under the brim that was supposed to bring more light to the retina. So I was like that guy that did everything, and you know, anything to get an edge. And it sort of matched my personality, I guess, and my experience. Once I started thinking about what I wanted to do with my life, it just seemed to make sense to go with my strength and pursue something like physical therapy. And when I did, that's when I fell in love with the profession. So Dave and I started SPEAR. At the beginning, it was just the two of us doing everything, from treating patients to scheduling them to billing the insurance companies and trying to get paid when they didn't pay. So we really started at that level, doing every single thing ourselves, and then the practice started to grow. You know, I think because we really know every aspect of the practice, it's helped us a lot. Our focus now is on our patients and having a great patient experience, whether, you know, from the moment they walk in the door to the treatment to making sure that they get the best of care and the best that technology can offer. We're always staying up on that, and I think that the patient experience is the most important thing. And I think that what's most unique about SPEAR are the people that are here and the way patients feel when they walk in the door, and the team approach, the amount of empathy that our therapists have towards your problems, and I think that's what really makes us unique. At the time that we were considering opening up a practice, I belonged to Equinox on the Upper East Side at the time. And there was a doctor from Lenox Hill that was going to give a lecture on ski conditioning programs. Now this was in 1998, and we started SPEAR in '99, January of '99. So this was right at the beginning, and I got excited about. I'm a tech guy, and at that time you could create your own business cards. That was like the new thing. Not so techy, but it was. I remember going to Staples, getting these business cards, and just being excited about it. I printed it on my laser printer, and it said SPEAR Physcal Therapy. Just had the name. It didn't even have a location yet. And I just put my home address. I lived on the Upper East Side, and I gave Dave a card with his home address because we were working on a location. So we go to Equinox, where this doctor's talking about his ski conditioning program, and we sat there, we listened. It was actually a good lecture. And then afterwards, we went up to him and told him we're two physical therapists, we're starting to practice together, and you know, we just wanted to let him know what we're doing and hope that it could fill a need that he had. And he got very excited, and he said, "Yeah, I need some people I can trust." And it was a great reaction. And he said, "Do you have any business cards?" So I smile at Dave because I've just made these business cards, and I hand him mine, and Dave hands him his, and he looks at it and he says, "Oh, terrific! 2 locations." We didn't even have one. So anyway, this doctor referred a patient to us on, that was a Friday, on Monday. The first patient called, and so we scrambled because we were talking to someone there was a private gym. That was our first location on 55th Street and 55th and Lex, and so I had to scramble and say, "Listen, we have a patient. I know we don't have an agreement yet. Is there anything we can do to speed it up? Because I don't want to say no to our first patient." And that was how we got our first patient, and it started there. He agreed, and saw that patient on Monday, and the rest is history.